There are many adverse events or negative effects that women experience when they take chemical abortion drugs. Those safeguards that the FDA originally had in place when they approved this drug have now been lifted. I was sitting and talking with a couple of the emergency room physicians, and they were telling me how frustrated they were because weekly women were coming into our emergency room with complications related to chemical abortions. What I've seen over the last few years is the frequency of complications related to chemical abortion drugs is increasing significantly. A couple patients come to mind. One was actually seen in person at an abortion clinic, but then a few days later, she developed a fever, she had really heavy bleeding, she required an emergency surgery due to the amount of bleeding that she was having, but also because she did have tissue still left in her uterus that needed to be evacuated. She also required a transfusion of multiple units of blood and several days of IV antibiotics. In fact, labs, when they came back, showed that she had an infection from 6 different bacteria because of her chemical abortion. What we are asking the FDA to do is to pull the approval of mifepristone and misoprostol for being used for chemical abortions. This is the scenario in which we see these high rate of complications for women and girls that take them.